my name is Gabrielle Berthelot, and I chose State Board of Nursing as my presentation topic. To start this presentation off, I wanted to introduce to everyone what a State Board of Nursing actually is. At some point in time, we have all been introduced to the Louisiana State Board of Nursing when applying for entry into the nursing program or to look up our student clinic license. A State Board of Nursing is defined as a state-specific regulatory body that is responsible for regulating the nursing practice. All 50 states in the U.S. and the District of Columbia collectively represent the National Council of State Boards of Nursing. I mentioned earlier State Boards of Nursing regulate the nursing practice, but what does that even mean? State Boards of Nursing are responsible for defining the qualifications an applicant must meet for licensure. An example of this is all registered nurses in the U.S. must take and pass the NCLEX RN examination to be eligible for licensure. They are responsible for setting the standards of care and prioritizing the safety of the patient. They define the state-specific scope of practices for registered nurses. And lastly, I have also included discipline, which may range from fines to loss of licensure. Whenever I started working on this presentation, I thought it would be a good idea to visit the Louisiana State Board of Nursing's website and share with everyone what I found. Whenever I opened the website, I was greeted with their mission statement. Their mission statement reads, "To safeguard the life and health of citizens of Louisiana by ensuring persons practicing as registered nurses and advanced practice registered nurses are competent and safe." I also included a screenshot of some tools and resources on their website that would benefit future nurses of the state of Louisiana to familiarize themselves with. The cues and competency that I thought best resonated with the State Board of Nursing is safety. As I mentioned earlier, patient safety is a part of the LSBN's mission statement. Safety is defined as minimizing harm through system effectiveness and individual competency. State boards are responsible for overseeing the standards of care of patients and evaluating if regional systems are meeting the standard of care and identify areas with room for improvement. They ensure continuous quality improvement with the ever-changing world around us. They also implement the investigative process to ensure that unsafe nurses are educated to prevent medical errors from happening in the future or removing incompetent nurses. For BSN Essentials, I chose competency number 10, Personal, Professional, and Leadership Development. The State Board of Nursing values continuous quality improvement not just for nursing processes, but for the nurses in which they provide their licensure to. Everyone has room for improvement in at least one area. As I mentioned in the previous slide, State Boards of Nursing measures performance and indicates room for improvement. From this, nurses are able to participate in self-reflection and see how they are able to contribute. The State Board also ensures that we participate in a set number of hours of continuing education classes to remain an educated and well-rounded nurse. With all that I just mentioned, this is to ensure that nurses are confident in their scope of practice with the ultimate goal of being a leader. There are leadership opportunities to serve on the board, but at the end of the day, all nurses should stand up and be a leader and advocate for their patients. Last but not least, I wanted to mention something that has affected our lives in one way or another: COVID-19. I'm pretty sure many of us remember watching the news 2 years ago and hearing about the shortage of equipment and nursing personnel. With the increased pressure from many parties to act, many state boards of nursing promptly acted to provide relief. I've added some examples below of how different state boards of nursing acted, but I wanted to touch a little extra on the last one I have included. I know that many of us were not in the nursing program in the spring of 2020, but I know that all of us had many questions as to how that even worked. Many state boards of nursing offer guidance and change regulations regarding delivery of nursing curriculum. One example that we are all aware of is simulation. Simulation was used in place of clinical hours in some areas, so I guess in a way we have COVID-19 to thank for all our shadow health assignments. Overall, a lot of responsibility fell on the State Board of Nursing to act promptly for well-being and safety of the patient.